practical, clinical examination of the cardiovascular system. The complaints of the patient or the when we have to check the cardiovascular system are breathlessness, chest pain, palpitation, that is the patient feels the heartbeat. Awareness of his own heartbeat is the palpitation. Then next is the giddiness, swelling over the limbs. These are the complaints for which we have to examine the cardiovascular system. Examination is under two headings, general examination and the systemic examination. Before examining, you have to note the name of your subject, age of your subject and sex of your subject. So write down the age, name and sex in your journal and then start the general examination. General examination and the systemic examination. First we will see about the general exam. So in general exam, first point we have to check is the build of the subject or the build of your patient. So what is the build? So build is the average of the height or is a proportion of the height and weight. It is a average skeletal structure of the subject. So you have to see the height of your subject and weight of your subject. He may be short, stout, or he may be tall and thin. That is the build. Normally, build is the average. Normally, what you have to write, first point in the general examination is the build. Is the proportion of the height and the weight. Normal build is average, but it may be short and stout, or it may be tall and thin. Second point is the nourishment of your subject. For nourishment, see the muscular structure of your subject. Muscular structure. That is the he is a normally nourished, or he is undernourished, or he is obese. So for nourishment, see the muscle structure. So is thin, that is the undernourished, or is overweight, that is obese, or is the normally nourished. So second point for the general examination is the nourishment of your subject. Then third point is the pallor. So what is the meaning of the pallor? What is the meaning of the pallor? No, not this. In anemia, pallor is present. So what is the coloration of the mucous membrane and the skin in the anemia? Paleness of the skin is called as the pallor. Paleness of the skin or the mucous membrane is called as the pallor. Normal color of the mucous membrane is pinkish or skin pinkish. If it is become white, it is become pale, it is called as a pallor. And pallor is the sign which is present in the anemia. Then where we have to check the pallor sites, one is the lower palpebral conjunctiva, second is the nails, color of the nails. Lower palpebral conjunctiva normal color is pink. Color of the nails is pink. Mucous membrane and the oral cavity. Lips, normally color is a pink. If there is a whiteness or there is a pale color, then pallor is present. These are the sites to check the pallor. Lower palpebral conjunctiva, nails, mucous membrane of the oral cavity and the lips. So check for the pallor. It is present in the anemia. Then next point in the general examination is the blood pressure. Pulse and blood pressure. First is the pulse. You know how to count the pulse for the 1 minute. Count the pulse for the 1 minute and write your reading beats per minute. Then next is the blood pressure. Record the blood pressure and write your reading. After pulse and the blood pressure, next point is the clubbing. So what is the meaning of clubbing? What is the clubbing? Bulging or the softening of the nail bed. Obliteration of the angle at the nail and the skin. It is the obliterated. Angle is the obliterated. And how to check for the clubbing, which is the test. This is the test. With this test, you have to check the clubbing. Name of this test is the Shamart's test. Shamart's window test. Name of this test is the Shamart's window test. So you have to put your both index fingers approximately and see the diamond-shaped gap between the two index fingers. It is called as a window test. Shamart's window test. How to check the clubbing like this. The distance between, or there is a window in between these two, then the clubbing is upset. If there is a bulging or there is an obliteration of the angle, there is a window is upset. Clubbing, it is called as a clubbing is present, and clubbing is present in the respiratory diseases or the congenital heart disease. In congenital heart disease or in the respiratory disease, clubbing is present. Then after the clubbing, we have to check for the cyanosis. So what is the cyanosis? Bluish discoloration of the skin. Bluish discoloration of the skin is called as the cyanosis. So where is this? What are the sites where to check the cyanosis? Tip of the fingers, tip of the nose, lips. These are the sites where the cyanosis or blue coloration of the skin is present. Then it is called as a cyanosis is present. Again, cyanosis is present in the congenital heart diseases. Then after cyanosis, next point for the general examination is the edema of the feet. So edema of the feet, what is the edema? Collection of the fluid in the interstitial tissue space. Excess, collection of the excess fluid in the interstitial tissue space causes swelling. It is called as the edema. And it is present on the dependent parts of the body. It is a dependent. So if the patient is ambulatory, that is if the patient is moving, the edema is present on the lower legs. If the patient is bedridden, lying down, the edema, which is the site where the edema will be present, if the patient is bedridden, paralyzed patient, for so months or the days, so many days. In lying down position, where it may be present, it is present on the dependent parts. Because of the gravity, it is present also. So ambulatory patient, it is present on the lower legs. If patient is bedridden, it is present on the sacrum. We have to check on the sacrum. So how to check the edema? On the bony prominence, that is the lower 1/3 of the leg, on the shin of the tibia, you have to press for the 30 seconds. You have to press with the help of the thumb for the 30 seconds. If the depression will be formed, or the pit will be formed, it is called as a pitting edema. If there is no depression or no pit, it is called as a non-pitting edema. So edema may be present in the congestive cardiac failure, hypoproteinemia, nephrotic syndrome. It may be present in the congestive cardiac failure, hypoproteinemia, nephrotic syndrome. These are the causes of the edema. Two types of the edema, pitting edema and the non-pitting edema. Then next is the examination of the neck veins. Next point for general examination is the examination of the neck veins. Distension of the neck. Normally, neck veins are not distant. Normally, neck veins are not distented. So, if there is any heart disease, that time there is a dilatation or the distension of the neck veins. So, examine the neck veins for the distension. That is the neck veins in the supraspinal notch, or at the neck there is an external jugular vein. So, examine for the neck veins. That is a distinction. So this is the general examination. You have to check for the breath of your subject, nourishment, pallor, pulse, record the pulse for the 1 minute, blood pressure, clubbing by the Shamart's window test, cyanosis, edema of the feet, and the neck veins. Here the general examination will complete. Then we will go for the systemic examination. Systemic examination is again under 4 headings. Systemic examination is under the 4 headings. One is the inspection. Second is palpation. Third is percussion. And last one is the auscultation. So under coherence, we have to finish the systemic examination of the cardiovascular system. So first is the inspection. For the cardiovascular system, question may be there, inspect the cardiovascular system for 10 marks. General examination also, inspection of the edema, examine the given subject for the edema, or examine for the pallor, examine for the clubbing. Each question is for the 5 mark general examination, and here for the serious 10 mark the systemic examination. So inspection is also the question for the final exam. That is the inspection. Examine the given subject for the by the inspection in the cardiovascular system. So first we will see the inspection. In the inspection, first point for the inspection is the chest wall. Examination of the chest wall. In the examination of the chest wall, we have to see the symmetry and chest wall is a symmetrical or the asymmetrical. Chest wall is a symmetrical or the asymmetrical. Normally the chest is a symmetrical. So first point is the chest wall. Symmetrical or asymmetrical. This is the suprasternal notch. Sternum. So distance between the anterior axillary line and the mid-sternal lines. This is a sternum. So distance between the anterior axillary line and the sternum should be same on the both sides. It should be same on the both sides. It is called as a symmetrical chest. In some diseases, there is a asymmetry of the chest. Suppose there is a depression of the sternum. There is a scoliosis. That is a scoliosis is the abnormality of the vertebral column. S-shaped spine is there. S-shaped spine. There are the 3 abnormalities of the spine. One is the kyphosis, second one is the lordosis, and third one is the scoliosis. So in scoliosis there is no uniformity of the chest wall. So there is an unequal shape of the chest wall. That is the scoliosis. The second is there is a depression of the sternum. There is a depression of the sternum in rickets, vitamin D deficiency. There is no symmetry of the chest wall. So first we have to check the symmetry of the chest. That is the right side is same to the left side. Then next point is the precordium. Examination of the precordium. So precordium is the area outlying the chest. Precordium is the anterior chest wall. So examination of the precordium. For the precordium, see there is a bulging or retraction of the precordium. Bulging, that is a swelling, or retraction, that is a depression. So normally chest wall is flat. Normally chest wall is flat. There is no bulging or there is no retraction. If there is a fracture of the ribs, collapse of the lungs, what happens there? There is a depression, that is a retraction of the ribs. Any bulging inside it causes the bulging of the precordium. So see for the retraction or the bulging of the precordium, that is the shape of the precordium. That is the anterior chest wall. Normally it is a flat. Then next is the apex bit. Third point for the inspection is the apex bit. So what is the apex bit? Apex bit is the lowermost and outermost part of the cardiac impulse. Apex bit is the lowermost and the outermost part of the cardiac impulse. So here inspection is there. We have to only inspect. Don't touch the subject. Our examination is an inspection. By the system here, first point is inspection. So only inspect or only observe. Only observe. Don't touch the patient. So for the apex bit, only there is observation of the apex bit. Normally, apex bit lies in the left fifth intercostal space. It is lies in the left fifth intercostal space. It is a lowermost and outermost part of the cardiac impulse. It is lowermost and outermost part of the cardiac impulse. Normally lies in the left fifth intercostal space. If we see the distance, 1.2 centimeter medial to the mid-clavicular line. It is a 1.2 centimeter medial to the mid-clavicular line or 0.5 inch medial to the mid-clavicular line. If we draw imaginary mid-clavicular line, then it is a 1.2 centimeter medial or 0.5 inch medial to the mid-clavicular line. So our normal position is it is in the left fifth intercostal space and 1.2 centimeter medially or 0.5 inch medially. So you have to observe the apex beat in the left fifth intercostal space. If it is a present, write down apex beat is a present. This is a inspection. So only see it is a present or it is a absent. If it is a lie behind the rib is absent. In thick chest wall, it may not be visible. In obese person or in the thick chest wall, it may not be visible. There is a outside that normal position, or there is a because of the enlargement of the heart. There is enlargement of the heart, hypertrophy of the heart, ventricular hypertrophy. It is a shifted. It is not at the normal position. In dextrocardia, it may be on the right side. In thick chest wall, it may be upside. Or it is behind the rib, it may be upside. So only observe and write if it is a present or the absent in the inspection. That is the apex beat. Then next is the pulsations. Next point for the inspection is the pulsation in the suprasternal notch, epigastric and the carotid pulsations. Fourth point is the inspection of the pulsations. So see the pulsations at the suprasternal notch here, at the suprasternal notch. Then second is in the epigastric region, and third one is the carotid pulsations at the neck. Carotid pulsations where the carotid is present in the neck. So see the pulsation in the suprasternal notch, in the epigastric region, or in the carotid. In epigastric region, the pulsations may be because of the left ventricular hypertrophy, or it is because of the liver pulsation, expansions, liver pulsations may be there present. Then next point for the inspection is the neck veins. Again, distended. We observe in the general examination neck veins distended or not distended. Here we finish the general inspection, systemic examination. Then go for the palpation. In palpation, we have to confirm the findings by which we observe in the inspection. So second point is the palpation. In palpation, first now apex beat. Examination of the apex beat. This is also a question in the exam. Apex beat. Examination of the apex beat. So first inspection, you know the normal position of the apex beat. It is in the left fifth intercostal space, medial to the mid-clavicular line, 0.5 inch or 1.2 centimeter. Then this is observation. That is inspection. Now you have to palpate. So put your right hand flat on the left side of the chest. Put your right hand flat on the left side of the chest, on the left fifth intercostal space. If you feel the pulsations over the hand, then you locate it with the index finger. Then you locate it with the index finger, mark with the chalk, and measure the distance from the mid-clavicular line. Measure the distance from the mid-clavicular line. And here we have to count the rate for the 1 minute. By putting your hand flat on the chest, count the rate for the 1 minute. It is the same as the heart rate. Then rhythm is a rhythm, and then the force, the character. Because if the patient is anemic or there is hyperdynamic circulation, force will be increased. Force will be increased. In feeble conditions, the force will be decreased. So count it for the 1 minute, then record the force and the rhythm for the epigastric, for the apex beat. Rate, rhythm and force. In inspection, only observe and write present or absent. But for the palpation, you have to count the rate for the 1 minute Examine for the rhythm, is it regular or irregular, and then force. Force is the adequate, that or the normal, or increase the force or decrease the force. Here, this is for the palpation of the apex beat. JVP we learn separately. About the JVP, we finish the practical separately. Then next is the percussion. Percussion for the cardiac border. Left cardiac border by the right cardiac border. Percussion means tapping. Inspection means observation. Palpation means touch, by touching or feeling. And third, percussion means tapping. So, by the percussion, we have to examine the left cardiac border and the right cardiac border. That is to map the cardiac release. To map the cardiac release, the normal the borders are normal, or if there is enlargement or there is a hypertrophy of the heart. If there is a enlargement or the hypertrophy of the heart, there is the normally the this left border or the right border is not their normal side. So first there is a left border of the heart. Percussion or the map the left border of the heart. So mapping or examining the left border of the heart. First is there are the 3 steps. First step is locate the apex beat. Now you know how to locate the apex beat. So first point is the locate the apex beat. You know the normal position of the apex beat. It is lies in the left intercostal space. Here you can see that. So this is the supraspinal notch. Then manubrium. To the manubrium, sternum is attached. It is called as a manubrium sternal junction on the angle of Lewis. This point is called as a manubrium sternal junction or the angle of the Lewis. Through this manubrium sternal junction, second ribs joints are attached. Here is the second rib to the manubrium sternal junction. Below there is a third, this is second. Below there is a third rib, fourth rib, fifth rib, sixth rib. Same on the right side. This is the left side. Same. Third, fourth, fifth, and sixth. So, first locate the apex beat. That is, first observe. If you see the pulsations, then feel the thrust with the flat hand on the left side in the left intercostal space. Then locate it with the index finger, mark. Then how to measure the ribs and the spaces. So how to count the ribs and how to count the intercostal spaces. We see that is the apex beat is in the left fifth intercostal space. So how to count the intercostal space? Now you know the second costal cavity of second rib is attached to the manubrium sternal junction. Little prominence is there. So palpate the manubrium sternal junction. Palpate the manubrium sternal junction. To that junction, second rib is attached. Then below the second rib, there is depression. That is the intercostal space. So second rib, palpate. Then there is a little depression. That is the space. Then again, third rib space, fourth rib space, fifth rib space. So prominent part is the ribs and depression is the intercostal space. Between the two ribs, there is the space that is the intercostal space. So first palpate the manubrium sternal junction, palpate the second rib, and then likely second, third, fourth, fifth to palpate and count the spaces. So between the fifth and the sixth rib, there is a fifth intercostal space. This space is the fifth intercostal space. So locate the apex bit here in the 5th intercostal space. If you draw a imaginary mid-clavicular line, suppose this is the clavicle on both sides. If you draw a mid-clavicular line, it is a 1.2 centimeter or 0.5 inch medial to the mid-clavicular line. Apex bit normal position is 1.2 centimeter or 0.5 inch medial to the mid-clavicular line. So draw an imaginary line at the mid-clavicle and see the distance from the mid-clavicle. So first locate the apex bit. That is the first step for the demarcation of the left border of the heart. Question in the exam, demarcation of the left border of the heart, 10 marks. So now you locating the apex bit. This is in the 5th intercostal space. Then what to do? At the axilla, there are the 3 lines. At the axilla, there are the 3 lines. Anterior axillary line, mid axillary line, and posterior axillary line. At the axilla, there are the 3 lines: anterior axillary line, mid axillary line, and posterior axillary line. So start percussion from the lateral to medial. Start percussion from the lateral to medial. From the anterior axillary line, you start percussion. So by putting your left hand in the left 5th intercostal space, start percussion. What happens? Which tissue is lying here? On the left side, which tissue? Which organs are there on the left side at the chest? Heart and lungs. So which type of the note you will hear on the heart and which is on the lungs normally? On the lungs, which type of the heart? Which type of the note? Resonant, because in the lung there is a air. So normally there is a resonant type of the note. So on the heart is now the solid structure. Blood is there. So which type of the note on the heart? Dull note. So start percussing on the left side, in the left 5th intercostal space, from the lateral to the medial. Which type of the note you will hear? That is a resonant, till lung is present. Till the lung is present, you will come there the resonant note. At one point, when there is a beginning of the heart, there is a note will be changed and it is a dull. It is a dull. Where there is a dull note, mark that point. Mark that point in the 5th intercostal space. So this is our apex bit. We got here dull note in the 5th intercostal space. Can go one space above, that is in the 4th intercostal space. Same procedure, start percussing from the lateral to the medial. Again, resonant, and dull. Where there is a heart starts, there is a dull. Mark this point in the 4th intercostal space. Again, go one space above, that is in the 3rd intercostal space. Same procedure, percussion in this 3rd intercostal space. Resonant. You got here the dull. You got the point in the 5th intercostal space, 3rd intercostal space, and in the 5th intercostal, 4th intercostal, and the 3rd intercostal space. This is the, by joining this point, you got the left border. That is the left ventricle. It's the left border of the heart, which is the left ventricle of the heart. So this is the how to demarcate the left border of the heart. Then second, in the percussion, demarcation of the right border of the heart. For the right border of the heart, how to now demarcate the right border of the heart? For the right border of the heart, start percussing from the 2nd intercostal space on the right side. Start percussing from the 2nd intercostal space on the right side. Now you know how to count the 2nd intercostal space. Again, palpate. This is the new patient for the new student. This is a new patient for the new student. Demarcate the right border of the heart. 10 marks. So what is your first step? Palpate the manubrium sternal angle. Palpate the secondary. Below the secondary, 2nd intercostal space. third rib, third space, fourth rib, fourth space, like this. So start percussing from the second intercostal space on the right side. Now you have to demarcate the right border of the heart. So start percussing on the right side from the second intercostal space. So start percussing from the second intercostal space like this. Which type of the note you will heard on the right side? Resonant note. You will heard there the resonant note. Because on the left side, because of the presence of the heart, there is a change in the note. But on the right side, there is a only lung is there. So all over there is a resonant note. To start percussing from the second intercostal space up to the sixth intercostal space. Up to the sixth intercostal space. Because in the sixth intercostal space, there is an upper border of the liver. But there is a dull note. Resonant, 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 dull. Because upper border of the liver is at the sixth intercostal space. All over there is a resonant, except the sixth intercostal space. Now what to do? Again, go one space above, that is in the fifth intercostal space. Same, start percussing from the lateral to the medial. Start percussing from the lateral to the medial. Which note is the what? Resonant, 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 resonant. All over there resonant, because all over there is a lung tissue is present. Go one space above, in the fourth intercostal space, same procedure, resonant, resonant. Again one space, that is the third intercostal space, resonant, 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 resonant. Why? Right border of the heart lies behind the sternum. Right border of the heart lies behind the sternum. But in exam, you do all the procedure. Don't tell directly to the examiner, right border of the heart is lies behind the sternum. Don't do like this. You have to do all the procedure. You palpate the mandibular sternal junction. You palpate the second rib. Then count the spaces. Start percussing from the second intercostal space. You got there resonant note, third space resonant, fourth space resonant, fifth space resonant. In the sixth intercostal, right sixth intercostal space, you will got the dull note because of presence of the upper border of the liver. Here, the upper border of the liver will be present, so there is a dull note. Then, from fifth intercostal space, from the lateral to the medial, start percussion. All over you will got the resonant note in the fifth, fourth, and third intercostal space. Because right border of the heart lies behind the sternum. Here your procedure will be finished. And then your answer is right border of the heart lies behind the sternum. So here it is the percussion is finished. Then next go for the auscultation. In the systemic examination, next is the auscultation. So what is the meaning of the auscultation? Listening. Auscultation means the listening. So auscultate or the listen the heart sounds. Listening of the heart sound in the auscultation. So how many types of the heart sounds present? 2 or 4? How many heart sounds are present? 2 or 4? 4. 4 heart sounds are there, but first and second are only audible. First with the stethoscope. First and second heart sound is audible with the stethoscope, and third and fourth are recorded with the help of the phonocardiogram. Third and fourth are not audible with the stethoscope. They can be recorded with the phonocardiogram. So what is the cause for the first heart sound? What is the cause for the first heart sound? Closing of the which walls? AV walls. Closing of the AV walls. That is the tricuspid and the mitral. Closing of the mitral and the tricuspid wall, that which are called as the AV wall, causes the first heart sound. Closing of this first AV wall causes the first heart sound. What is the cause for the second heart sound? Closing of the semilunar. Which are the semilunar walls? aortic and pulmonary. Aortic and the pulmonary. So there are the four types of the walls: mitral wall, tricuspid wall, aortic wall, and the pulmonary wall. Four walls. And when we are ausculting, we are putting the stethoscope on the chest, not on the walls. When we are ausculting, we put the stethoscope on the patient's chest or the subject chest. So we not put the stethoscope on the walls, because walls are lies behind the sternum. Walls are lying behind the sternum, and we putting the stethoscope on the areas. We are putting the stethoscope on the areas: mitral area, tricuspid area, aortic area, and the pulmonary area. So where these areas are lying? Again, this is the suprasternal notch. Manubrium sternum junction. So where these areas are lying? Walls are behind the sternum. So this is the second rib, third rib, fourth rib, fifth rib, sixth rib. Second, third, fourth, fifth, sixth. So this is the second intercostal space. Third intercostal space, fourth intercostal space, and this is the fifth intercostal space. First, mitral area. Mitral area is lying in the left fifth intercostal space. Mitral area is lying in the left fifth intercostal space at the apex bit. At the apex bit. Left fifth intercostal space. Mitral area. Where is the tricuspid area? On which side? So tricuspid area is on the fourth intercostal space on the left side. So this is the mitral area at the apex bit. This is the tricuspid area at the fourth intercostal space. Then aortic area in the second intercostal space, just lateral to the sternum. Aortic area, second intercostal space, just lateral to the sternum. Pulmonary area in the left. This is left and this is right. Pulmonary area on the left intercostal space, 2 centimeter lateral to the sternum. 2 centimeter or just lateral to the sternum on the left side. So right second intercostal space aortic, left second intercostal space pulmonary, left fourth intercostal space tricuspid, left fifth intercostal space mitral. And we have to check on the areas. For the auscultation, we have to check on the areas, not on the walls, because walls are lying behind the sternum. And only the two sounds, first and second heart sound, is audible with the stethoscope. So, what are the questions in the exam? Examine for the first heart sound and report your findings. Or examine for the second heart sound and report your findings. Or examine mitral and tricuspid areas. Or auscultate mitral and the tricuspid area. Or auscultate aortic and the pulmonary area. So, for the auscultation, the four types of the question are there, like this. Directly auscultate on the areas, or auscultate first heart sound or the second heart sound. 10 marks. Again, this question is for the 10 marks. So, how to now auscultate the first heart sound? First heart sound is produced because of the closure of mitral and tricuspid walls, and it is the best heard. These two sounds, first and second heart sound, you can listen all over the four areas. These two sounds you can hear at four areas, here, 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 or here. But first heart sound is best heard at mitral and tricuspid, because first heart sound is produce closure of these walls. Second heart sound also heard at the 4 areas, but best hurt at the aortic and pulmonary because it is produced by closing of these 2 valves. So if your question is auscultate for the first heart sound. So what is your question? Auscultate for the first heart sound. You know, you are a new student. So your first question. You don't know where is the apex beat, where is the fifth intercostal space. You go to the examiner, put one, you take one slip from the examiner table, and your question is auscultate for the first heart sound. So what it is the procedure? You go to the subject, stand on the right side of the subject. Again, palpate mandibular sternal junction. Because without that, you can't palpate the spaces. Or the you can't palpate the ribs. So first, palpate the mandibular sternal junction. Same procedure. Palpate the rib spaces. You know, mitral area is in the left fifth intercostal space. Tricuspid area in the left fourth intercostal space. So palpate the ribs, palpate the spaces, and then put the stato in the fifth intercostal space. That is the mitral area. Then in the fourth intercostal space. Again, also you put your stato in the aortic area and the pulmonary. Because at the 4 places you can hear the first heart sound, but it is the best heard in the mitral and tricuspid. When you are ausculting for the heart sounds, your one hand is on the stato and your other hand, suppose you are holding the stato with the right hand, your left hand should be on the carotid artery. Your left hand should be on the carotid pulse or the carotid artery at the angle of the mouth at the neck. Why? One, your other hand should be on the carotid pulse. What may be the cause? Because first heart sound coincides with the carotid pulse. Examiner may ask you, how will you differentiate between first heart sound and the second heart sound? How will you differentiate between first heart sound and the second heart sound? First heart sound is coincides with the carotid artery or the carotid pulse. So your other hand should be always on the carotid pulse. Then, if the question is auscultate for the second heart sound, same procedure, palpate the mandibular sternal junction, palpate the rib, palpate the spaces, and put the stato first in the aortic area, then on the left side pulmonary area, also on the mitral and tricuspid area. And what is your answer? I heard the second heart sound best in the aortic and pulmonary area. Or I heard the second heart sound all over, all 4 areas, but best or the prominent heard at the aortic and pulmonary. What are the characteristic features of the first and the second heart sound? First heart sound is soft. First heart sound is a soft, low pitch, short duration. First heart sound is a soft, low pitch, short duration. Second heart sound, what is the characteristic of the second heart sound? Second heart sound? First is a soft or dull, prolonged and low pitch. Prolonged. Soft or the low pitch, prolonged and low pitch. Soft. Second heart sound is a high pitch. Shorter duration. Opposite to first. High pitch, shorter duration and sharper. These are the characteristics of the first and the second heart sound. So in journal, on the page number 76, your journal, open your journals, page number 76, write down the name of your subject, age, sex, symptoms of the patient, dyspnea, that is the breathlessness, chest pain, and palpitation. Palpitation is the awareness of the own heartbeat. Awareness of the own heartbeat. That is the palpitation. Then general examination. Write build. Examine your subject for the build. That is average height and weight, skeletal structure. Nourishment, muscular structure. Pallor, present or absent. Pulse. Count the pulse for the 1 minute. Write pulse beats per minute. Record the blood pressure. Write your finding. Clubbing, present or absent. Cyanosis, that is bluish discoloration of the skin, present or absent. Edema on the feet, present or absent. Neck veins, distended or not distended. Systemic examination. First, inspection. Chest wall, symmetrical or asymmetrical. Second, precordium, bulging or retraction. Apex bit, seen, not seen. Only write this much for the inspection. Then pulsations, pulsation at the suprasternal notch, pulsations at the epigastric area, pulsations at the carotid area, at the neck. Neck veins, distended or not distended. Then go for the palpation, apex bit, position, left hip intercostal space, 1.2 centimeter medial to the midclavicular line or 0.5 inch medial to the midclavicular normally, or 9 centimeter lateral to the midsternal line. If you count the distance from the midsternal line, it is a 9 centimeter lateral to the midsternal line or 3.5 inch lateral to the midsternal line. Character, that is a rate. Count the rate for the 1 minute. Now you are palpating, so put your hand flat. Count the rate for the 1 minute. Write your observation. Rhythm, regular, irregular, force, normal, increased force or decreased force. Percussion, palpebral borders, left border of the heart and the right border of the heart. So, how to write for the left border of the heart? For the left border of the heart, in left fifth intercostal space. In first point, if you are writing for the left border of the heart, first, in left fifth intercostal space, dash centimeter from midclavicular line. Second, in left fourth intercostal space, dash centimeter from midclavicular line. Third point, in left third intercostal space, dash centimeter from midclavicular line. By joining these 3 points, I got the left border of the heart. For the right border, right border lies behind this sternum. For the right border lies behind this sternum. This one. Auscultation, mitral, first heart sound, best heart, second heart. What to write? For the first, best heart, heart. Tricuspid, best heart, heart. Aortic, first heart sound, heart, second, best heart. Pulmonary, first heart sound, heart, second heart sound, best heart. Here we finish the cardiovascular system exam. Shinde, I will demonstrate how to examine the cardiovascular system. Sleep the table man definitely sleep in your chula. So questions for the exam from the cardiovascular system. Auscultate for second heart sound in given subject and report your finding. Auscultate for second heart sound in given subject and report your finding. Next, examine cardiovascular system by inspection in a given subject and report your finding. Examine for apex beat by palpation. Examine for apex beat by palpation and report your finding. Auscultate for first heart sound and report your finding. Examine for right heart border in a given subject and report your finding. Examine for left border and report your finding. Auscultate mitral and tricuspid area for heart sounds. Auscultate for pulmonary and aortic area for heart sounds and report your finding. So all for the palpation, percussion, auscultation, all and inspection also there are questions in exam, and each question is for the 10 marks. मी राईट साइडला उभं राहणार, त्यांना दिसणार नाही, मी इकडे उभं राहिले तर उलट इकडे उभं नाही, फक्त हे वापरणार. इकडे फक्त मला उभारायला जागा ठेवली बस. प्रत्येक ठिकाणी प्रत्येक 5 मिनिटांनी सांगितलं एकच काम सांगितलं. तुम्हाला दिसत असेल तर बसा, नाही तुम्ही बरोबर बघा, तिथं सांगा. तर ऍटलीस्ट फर्स्ट बेंचवर बघा. असं सेपरेट करणे प्रत्येकाला दिसतं. Step 1 केला. एकाने पॉइंट वाचायचे जनरल सगळं पॉइंट वाइज एक एक पॉइंट वाचायचा, एक एक दाखवायचा. आणि बघा फर्स्ट जनरल एक्झामिनेशन. In general examination, first point is the build. So for the build, see the height is a proportion of the height and the weight of the subject, of the patient, height and the weight. So what to write for the build? So patient may be short and stout. That is, height is less than the. No, what is the normal height? What is the normal? 5 feet. 6 is abnormal. 6 feet is abnormal. Range 5 to 6 or 7. 5 to 6. Okay. Suppose this subject is less than 4 feet. Is short. Is more than 6 feet. Is a tall. So is the average of the height and the weight. Normal average weight is normal average 60. 90 kg obese. 30 kg thin. So build average. C is a stout and short, or is a tall and thin. Second point is the nourishment. For the nourishment, muscle structure, muscular. Is undernourished, that is weight is 30 years man, but weight is only 25 or 28 kg. Undernourished. Or 30 years man, weight is 90 kg. Is the obese. So for the nourishment, see the muscle structure. The undernourished, normal or is a obese. Then next is the pallor. So pallor is the paleness of the skin or the whitish coloration of the skin. So for this, first we have to examine the three sides. One is the lower palpebral conjunctiva, second is the color of the nails, and third is the mucous membrane of the oral cavity. So for the lower palpebral conjunctiva, ask the subject to see to his feet down and revert the lower palpebral conjunctiva and examine for the pallor. Like this, your lower palpebral conjunctiva and see the color of the conjunctiva. It's a normally pink. If it is a pale, pallor is present. Second is see the color of the nails. Color of the nails normally pink. If it is a white, pallor is present. And third, oral cavity, ask him to say and examine the color of the mucous membrane of the oral cavity, color of the lips. This is the pallor. Okay, next is the pulse. Record the pulse for 1 minute, write your finding. Record the blood pressure, write your finding. The next, blood pressure, record blood pressure. Next is the clubbing. Clubbing by this Sharma's window test. Ask him to approximate the 2 index finger and see the diamond shaped gap between this present or absent. If the gap is present, this test is absent, no clubbing. No clubbing. If there is a no window is seen, then the clubbing is present, and it is present in the congenital heart diseases and the respiratory diseases. Pallor is present in the anemia. Next is the cyanosis, bluish discoloration of the skin. For that, see the tip of the fingers, tip of the nose, and lips. If blue color is there, cyanosis is present. Again, it is present in the congenital heart diseases. Next is the edema. Edema, to check the edema on the lower legs, that is, it is present on the dependent part. Patient is ambulatory, moving, then it is present on the lower legs. If the patient is lying or the mainly dead, so it is present on the sacrum. It is present on the sacrum. So if the patient is ambulatory, you check the edema on the lower leg, on the lower 1/3, on the shin of the tibia. Press for the 30 seconds on the shin. Press for the 30 seconds on the shin. If the edema is present, there the pressure will be fast. It is called as a pitting edema. Present in the congestive cardiac failure and hypoproteinemia. It is present in congestive cardiac failure and the hypoproteinemia. And next is the neck veins. So see the neck veins distended or not distended. Like this. Ask him to turn his head on the one side, then other side. See here, the neck veins are distended. That is a dilated or not. This is the examination of the neck veins. The next systemic examination will finish. Then go for the inspection. In inspection, first is the chest wall. Chest wall is a symmetrical or the asymmetrical. Chest wall is a symmetrical or the asymmetrical. So see the distance. Draw imaginary line at the mid-sternum. So distance between the anterior axillary line and mid-sternal line should be same on the both sides. On the right side and on the left side, it should be same. In some conditions, like the deformity of the sternum, rickets, scoliosis, deformity of the spine, there is a shape will be asymmetrical. There is no symmetry on the both sides. Next is the precordium. Precordium, that is the area overlying the chest. This is called as the precordium. So see, there is a bulging of the precordium or the retraction of the precordium. Bulging or the retraction. If there is a rib fracture because of the accident, there may be retraction, depression. That is the shape of the precordium. Next is the apex pit. For the examination of the, you know the normal side of the apex pit. It is in the left side in the left 15 process space. So you bend tangentially at the level of the bed and you watch here on the left side. You watch here on the left side. If you see the pulsations, you see the pulsation. That is, skin is moving here on the left side in the 15 process space. Apex bit is present. Apex bit is present. If it is a not C, apex beat is a upset. Again, pulsation. Pulsation is in the suprasternal notch, epigastric and the carotid. So this is a suprasternal. This is a suprasternal notch. This is suprasternal notch. So see pulsations here. Jugular venous pulsations may be present here. The suprasternal notch. This area is epigastric area. Epigastric pulsations is because of the ventricular hypertrophy or because of this aortic aneurysm. Aorta is there at the center. In thin person, there you can see also the aortic pulsations. And these are because of the pulsations of the liver. Liver pulsations can you also see there in the epigastric area. This is epigastric area. This is suprasternal notch and carotid pulsations at the neck. Again, ask him to turn the head and see the pulsations. Can you see on the right side, also on the left side? Inspection is finished. Then palpation. Palpation first is the apex beat. For the apex beat, first inspect for the apex beat. Then you put your right hand on the left side flat, like this. If you feel, you locate it with the index finger. If you feel, by putting flat hand, also you can confirm with the left ulnar border, because ulnar border is more sensitive. So you confirm it with the ulnar border, and if you feel, then you locate with the index finger. After locating with the index finger, you mark with the chalk. You mark with chalk. Suppose I feel here, you mark it here. And then you palpate the mandibular sternal junction. Little prominence is there, that is the second rib is attached, that is junction. So second rib is here, prominent. Below that there is a depression, that is the second intercostal space. Again, third rib, third space. Fourth rib, fourth space. Fifth rib and fifth space. So this is in the fifth space. Draw an imaginary mid-clavicular line from mid-clavicle, draw a line and measure the distance from the mid-clavicle or from the mid-sternum. It is 1.2 centimeter from the mid-clavicular line. Normally it is a 1.2 centimeter. So measure the distance with the help of the measuring plate. Draw an imaginary line and you measure the distance from the mid-clavicular line to your marking point. And it is a normally 1.2. Otherwise, from the mid-sternal line, it is a 9 centimeter from the mid-sternal line. Like this. Measure from here or to here. And then, after measuring, you have to count the rate. So put your hand and count the rate for 1 minute. Write the rate of the apex beat. Feel the rhythm, regular or irregular. Force, normal or increased. How to differentiate between the normal force or the adequate force and the increased force? If now he is a normal person, force is normal. If you ask him to do exercise, jump, force will be increased and you feel the increased force. So this is the examination of the apex beat. Then you feel the last question. Next is the percussion. So percussion for the right quarter of the heart and percussion for the left quarter of the heart. So for the left, first we will see the how to percuss for the left quarter of the heart. For the percussion of the left quarter of the heart, same procedure. First observe the apex beat, locate the apex beat, mark the apex beat. This first step. Then palpate the mandibular sternal junction, second rib, second space, third rib, third space, fourth rib, fourth space, like this. Come up to the fifth space. Make sure your apex beat or your mark is in the fifth intercostal space. Then from the laterally, anterior axillary line. There are the three lines in the axilla: anterior axillary line, mid axillary line, and posterior axillary line. On the posterior side, there is a posterior axillary line. So in the fifth intercostal space, from the anterior axillary line, start percussion. start percussion. You will got a resonant note because of the presence of the lung. But at one point, note will be changed. That is the beginning of the heart, or that is the outer side of the heart. So, what here? Resonant, resonant, resonant. 1 point you got the W. Again, you mark in the 5th intercostal space. Then go one space above, that is 4th intercostal space. Same, start percussing from the lateral to the medial. Resonant, resonant, resonant. 1 point you got again the W. This is in the 4th intercostal space. Go one space above, that is in the 3rd intercostal space. Same procedure. Resonant, 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 quarter bell. And by joining these 3 line points, you got the depth order of the heart. 5th intercostal, 4th intercostal, and the 3rd intercostal space. You got there the 3 points. Join these 3 points. This is the depth order of the heart. Then demarcation of the right order of the heart. For the right order of the heart, palpate angle, palpate ring, palpate spaces. Start percussing from the 2nd intercostal space. Here note will be changed, and this is the upper border of the beat. Mode will be changed. Resonant, 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 resonant. Here change, and then count the phases, 2nd, 3rd, 4th, 5th, and 6th. Upper border of the liver lies in the 6th intercostal space. Upper border of the liver lies in the 6th intercostal space. So from the 5th intercostal space, same procedure, start percussing from the lateral to the medial. All over you got the resonant note in the 3rd, 4th, 5th space or 5th space. Because right border of the lies is right behind the sternum. Right border is here behind the sternum. So all over here on the right side there is a resonant note. So this is the demarcation of the right border of the heart. And last is the auscultation of the face. Auscultation for the heart sound. For auscultation of the heart sound, auscultation for the 1st and 2nd heart sound, or auscultation for the 4 areas: mitral, tricuspid, aortic, and the pulmonary. So first, if the question is auscultate for the mitral and tricuspid, the question is auscultate for the mitral and tricuspid. You don't know where is the mitral and the tricuspid. So how to start the procedure? Again, palpation of the junction, palpation of the angle, ribs and spaces. You know 4th intercostal space, tricuspid area, 5th intercostal space, mitral area. So palpate the ribs, palpate the spaces on the left side. In the 4th space, put the stethoscope, that is the tricuspid area. And in 5th intercostal space, mitral area. When you are ausculting for the heart sounds, your one hand is on the stethoscope, and one hand is on the carotid artery. At the angle of the mouth, you put your one hand on the carotid artery. So this is the procedure for the auscultation of the heart sounds. So this is the tricuspid area, mitral area. If the question is ausculted for the aortic and pulmonary, again palpate angle, palpate ribs, palpate spaces. This is the aortic on the right side, one hand again on the carotid artery, and this is the pulmonary. Aortic, pulmonary. Otherwise, first heart sound, put stethoscope, tricuspid, mitral, aortic, pulmonary. Second heart sound, aortic, pulmonary, mitral, like this. Put all over the 4 areas. And what is your answer? First heart sound is best heard at the mitral and tricuspid, and third aortic and pulmonary. Second heart sound best heard at the aortic and pulmonary. Also heard on the mitral and tricuspid. The best at the aortic and the pulmonary. How will you differentiate between first and second heart sound? First heart sound coincides with the carotid artery, carotid pulsation. So put one hand on the carotid artery at the angle of the mouth at the And characteristics are the first have sound low pitch, long duration, and soft. Second have sound sharper, high pitch, and short as compared to the first. Here we finish the cardiovascular system examination. Any questions or any queries? Also, there is a diagram in the page number. Who knows that? 79. So, on the page number 7, there is a lip page. You have to draw there the areas and walls. I will put on the notice board from where you publish. 4 areas and the 4 walls. On the page number 79. Unmute.